At 03:17 a.m. on June 7, 1944, a British field medic named Captain Harold Wyndham crouched in a bomb crater 30 yards behind the Normandy beachhead. Around him, the darkness pulsed with tracer fire and distant explosions. In his medical pack, he carried 42 morphine syrettes. By dawn, he would use every single one. And by the following evening, over 200 Allied soldiers would slip into medically induced comas that military command had never authorized. The beaches of Normandy were supposed to be secured within hours. Instead, they became killing grounds that stretched across 3 brutal days. Casualties poured into field stations faster than ambulances could evacuate them. Men with shrapnel wounds, severed limbs, and chest trauma lay on bloodied canvas, waiting for relief that medical doctrine said should be administered sparingly. Standard protocol dictated 1 syrette per patient, maximum 2 for severe trauma. Each syrette contained 16 milligrams of morphine tartrate, enough to numb pain, not enough to silence screaming. Captain Wyndham had been a civilian anesthesiologist before the war. He understood dosage, tolerance, and respiratory depression better than most military physicians. He also understood something the field manuals didn't account for, that agony could kill faster than blood loss, that a soldier thrashing in pain used oxygen his torn body couldn't spare, that sometimes mercy required mathematics the Army hadn't written down. On that first night, he made a decision that would haunt military medical boards for decades. He began administering triple doses, sometimes quadruple. Soldiers who should have remained conscious, drifting in and out of morphine haze, instead sank into deep narcotic sleep. Their breathing slowed, their pulses steadied, and their chances of surviving long enough to reach a surgical theater increased by margins Wyndham calculated in his head, but never wrote in reports. If you're watching this, you already know that some of the most important decisions in history were made by individuals who refused to follow protocol. Subscribe to this channel, and you'll discover more untold stories of wartime innovation that command tried to bury. We release 2 new documentaries every week, each one uncovering the moments when survival required breaking every rule in the manual. The first soldier Wyndham overtreated was a 19-year-old private from Manchester. Shrapnel had torn through his abdomen, shredding intestines and nicking his liver. The boy was screaming so violently that 2 orderlies couldn't hold him still. Wyndham knelt beside him, spoke 2 quiet words no one else heard, and emptied 3 syrettes into his thigh in rapid succession. 48 milligrams, 3 times the maximum recommended dose. Within 90 seconds, the private's eyes rolled back. His body went limp. The screaming stopped. An hour later, a surgeon successfully removed the shrapnel and repaired the damage. The private remained unconscious for 16 hours. When he finally woke in a field hospital in Portsmouth, he remembered nothing after the beach. Medical staff noted prolonged narcotic sedation in his file, but asked no questions. Wyndham had already moved on to the next patient. By noon on June 8th, Wyndham had administered high-dose morphine to 73 soldiers. Most received between 32 and 64 milligrams, doses that would trigger immediate investigation in civilian hospitals. But this wasn't a hospital. This was a coastline where men bled out waiting for triage, where the capacity for suffering exceeded the capacity for care, where every decision balanced survival against doctrine. Command noticed when casualty reports began including unusual patterns. Soldiers arriving at rear hospitals were unconscious far longer than expected. Respiratory rates were dangerously low. Some required naloxone to reverse narcotic depression. A medical officer in Portsmouth flagged 12 cases in a single morning, all traced back to a single treating physician at Sword Beach. Captain Harold Wyndham. The investigation began quietly. A colonel from the Royal Army Medical Corps arrived at the forward aid station on June 10th. He reviewed morphine inventory logs and compared them against patient counts. The numbers didn't reconcile. Wyndham had requisitioned 620 syrettes over 3 days. Average consumption for similar casualty loads was 240. He'd used more than double the expected supply.
When confronted, Wyndham didn't deny anything. He stood in a tent still stained with blood and stated his reasoning with the precision of a man who'd run the calculations 1,000 times. High-dose morphine reduced shock progression. It suppressed the hypermetabolic response to trauma. It decreased oxygen consumption in patients who couldn't afford to waste a single breath. And, most critically, it kept men still long enough for overwhelmed surgeons to work without restraints or additional personnel. The colonel listened without interrupting. Then he asked a single question. How many men had died from respiratory arrest caused by morphine overdose? Wyndham's answer was immediate. 0, not 1. Every patient who received high-dose sedation had been monitored continuously. At the first sign of respiratory depression below 8 breaths per minute, he'd administered stimulants or assisted ventilation manually. He'd kept them alive long enough to reach surgery, and the survival rate among his patients was 11% higher than the sector average. If you believe medical innovation should be measured by lives saved, not rules followed, hit the subscribe button now. This channel is dedicated to documenting the moments when expertise overruled authority, and the outcomes proved which mattered more. Next week, we're covering the nurse who rewrote burn treatment protocols using cooking oil and defied court-martial to save an entire battalion. The investigation should have ended in a court-martial. Instead, it ended in a classified memo. High-ranking medical officers reviewed Wyndham's patient outcomes and compared them against standard dose protocols used at other beachheads. The data was undeniable. His patients survived at higher rates. They required fewer follow-up surgeries. They experienced less post-traumatic infection. The morphine comas, while unorthodox, had worked. But the British Army couldn't officially endorse what Wyndham had done. Approving his methods would require rewriting field medical doctrine in the middle of a war. It would mean admitting that a single captain understood trauma pharmacology better than the entire medical command structure. And it would open the floodgates for every field medic to make dosage decisions based on personal judgment rather than standardized protocol.
So they buried it. Wyndham received a verbal commendation and a warning. Continue saving lives, but do it quietly. Don't document the doses. Don't publish the outcomes. And don't train anyone else to follow his example. The morphine comas were officially attributed to combat stress response and variable metabolic factors. No mention was made of deliberate overdose as a survival strategy. Wyndham returned to the front. Over the next 11 months, he treated more than 4,000 wounded soldiers across France, Belgium, and Germany. His methods remained consistent. High-dose morphine for severe trauma, continuous monitoring, zero tolerance for preventable death. By the time the war ended in May 1945, his unofficial survival rate stood at 87%. The official Army average was 73%.
After the war, Wyndham returned to civilian anesthesiology in London. He never spoke publicly about his wartime dosing practices. He published no papers. He trained no students in his techniques. When interviewed by medical historians in 1978, he described his service as routine field medicine under difficult conditions. The 200 men he'd placed in morphine comas were never mentioned.
Their files, scattered across a dozen military hospitals, remained unconnected. It wasn't until 1998 that a researcher cross-referencing Normandy casualty data noticed the pattern. Patients treated at Sword Beach between June 7 and June 18, 1944, showed statistically anomalous survival rates and morphine consumption levels. Further investigation revealed Wyndham's name in over 300 medical reports, always accompanied by the same notation: prolonged sedation, stable vitals, full recovery.
The researcher contacted 12 surviving soldiers who'd been treated by Wyndham. None remembered the captain's face. Most remembered nothing after being wounded. But when told they'd received triple-dose morphine and spent up to 20 hours unconscious, their responses were identical. If that's what kept me alive, then I'm grateful someone knew better than the manual. Modern military medical doctrine has evolved. Trauma care now recognizes that pain management directly impacts survival outcomes. Morphine dosing protocols are individualized based on injury severity, patient weight, and hemodynamic stability. The rigid limits Wyndham violated in 1944 no longer exist. But they existed then, and he broke them anyway. Before we close this story, consider what it means to trust your knowledge over your orders. If you want to see more documentaries about the people who made that choice when lives were at stake, subscribe and turn on notifications. We dig through declassified records, survivor testimonies, and forgotten medical archives to bring you the stories textbooks won't tell. Every video is a piece of history that someone tried to erase. Captain Harold Wyndham died in 1989 at the age of 73. His obituary in The Lancet described him as a skilled anesthesiologist and a decorated war veteran. It mentioned his service in Normandy, but said nothing about morphine, comas, or the 200 men who survived, because he understood that sometimes the right dose is the one that breaks the rule. The British Army never formally acknowledged his methods. They also never formally condemned them. The silence, in the end, was its own kind of verdict. The war moved on. His patients lived. And somewhere in a dusty archive in London, there's a file with his name and a single question written in red ink that was never answered. If the rules cost lives and breaking them saves lives, which is the greater crime? Wyndham never wrote his answer. He just kept working. And that, perhaps, was answer enough.